We're doing 2 injections prior to chemotherapy dose administration. One is an antihistamine, just to kind of head off any potential adverse reactions. We don't want the chemotherapy drug to hit their system and incite this inflammatory allergic reaction. So we try to hit those things off beforehand. If we can do some sort of preemptive effects to reduce the risk of those, that's always good and safe. It's just an injectable antihistamine and also an injectable anti-nausea medication just to help settle the stomach down. Because sometimes as that chemotherapy is hitting their system, it will make them feel a little bit nauseated and they'll throw up. So we try to minimize those effects as best we can with a secondary injection. An anti-nausea injection, this one will actually last for 24 hours, but if we can get past that period of time, then we should be good. It doesn't happen very often, but again, if we can affect them and make them more comfortable through this whole process, that's all the better. In some cases, for some dogs that are really nervous about being here, they won't sit still and take their chemotherapy, a little bit of a sedative helps to kind of calm them down. Sarge, he really doesn't need that. He is very compliant to lay here and take his drugs without any problems, so we don't have to worry about giving him any sedatives. But for some dogs that are more anxious about being here and don't want to be handled by people that they don't really know, then a little bit of sedative makes things just much easier on them, on the techs that are administering the drugs. It just makes it for a lot smoother process. Here's his antihistamine. And his second injection, sometimes it burns a little bit. Some dogs will react to it, some don't. It's more of, I want you to know what I'm doing back here right now. But this one can kind of sting sometimes. He's usually pretty good about kind of twitching a little bit. He feels it. There you go. We like to scratch that area though. Because I know it's itchy. It's just harder for him to scratch where he wants to scratch. There you go. I went to that. Okay.